We've been hearing about the serologic tests for some time now, and the idea here is that once you get the infection and you develop antibodies to that infection, those antibodies are around for quite some time. We don't exactly know how long they're around for, but we do now have tests that can detect those antibodies in the blood. Some of those are very simple sort of prick tests where you just take a drop of blood. And what that's going to be able to tell us is whether people have had this infection in the past. So instead of going out and swabbing people and looking for active infection in a bunch of people who are asymptomatic, which we're doing in more and more places now, this is a way to sort of look back in time and say, has this person had the infection in the past? And it's a sort of record in their bloodstream of them having had this infection. It gives us a much better idea of what that spread has actually been in the community.
So that's my question then. Alberta is going to make the results available so, in Alberta's words, it can inform treatment decisions. What will authorities, researchers, scientists, what will they then do with that information?
I think a couple of things. So one is from just a public health point of view, understanding the spread of the infection. How many people were infected, potentially how close to herd immunity are we in different parts of the country? I think the answer will be we're far from it in any part of the country, really. There have been some studies in places where we've heard of lots of infections like New York, and they were no more than about 10% of the random people that they sampled who had evidence of having had the infection. So it's still a low number, but it will give us an idea of how much spread there was. It might help in individual cases if, let's say, somebody's sick, they have infection symptoms, viral symptoms, and the question is, is it the novel coronavirus? If they've had an antibody test in the past and we know they've already had the novel coronavirus, that might mean they're less likely to have it again. So we might start thinking about other potential causes for illness. So it might be helpful in individual cases as well.
The whole immunity question is a really interesting one. How long a person is immune, if indeed immune, after COVID-19, and there's a Chinese study that our CBC health reporters have been looking at that found the levels of an antibody in recovered COVID-19 patients dropped sharply in the 2 to 3 months after infection, and that was for both symptomatic and asymptomatic patients. So immune and then a sudden drop-off in immunity. What questions does that raise for you?
So the study, it's a small study. So it's 37 asymptomatic patients and 37 symptomatic patients that they compared. And they're trying to understand over time what that immunity looks like and what those antibody levels look like. It's not surprising that the antibody levels fell. That happens for all infections. Once the infection is gone and the body has cleared it, we don't need those antibodies, so they go down to a much lower level. What was a little bit surprising in this study is that about 2 to 3 months after the acute infection, 40% of people who had an asymptomatic infection, they simply couldn't find the antibodies anymore. That number was around 13% in people with symptomatic infection, so it was lower, but still, 13% of people who were sick, 2-3 months later, they seemed to have no antibodies. But the caveat, lots of caveats to that. One is that, again, it's a small study. The second is that, are we looking for the right antibodies? They've looked for 2 specific, what are called IgG antibodies, but there may be many others that they're missing. In fact, they did something called a neutralizing antibody test, which is sort of a broader test to see if there are any antibodies in the bloodstream that prevent the virus from getting into cells. And the number of people who didn't have those antibodies was only about 10%, so it's lower. And the last thing I'll say is that the antibodies are not the whole story, antibodies at least that we can detect with these types of assays. There are other mechanisms by which the body has immune responses to viruses, and one of them is called memory cells. And these are cells that once you form the antibodies, they sort of store those antibodies in that signature of the antibody, and they continue to be around in very low levels. And if you get the infection again, they act as a memory. They remember that infection and they start growing then, and they start releasing the antibody. But we have a hard time detecting those memory cells. So that's an example of how even if we can't find antibodies, it doesn't mean that there's no immunity after infection.
That's so interesting. We're learning so much about medicine and science as a result of confronting this coronavirus. Because I was wondering, even though it is a small study, and that's important to keep in mind, if there is an importance in its findings, perhaps even in terms of vaccine development, if we know that immunity is not long-lasting, for example.
Absolutely. And, it raises concerns, that The main issues around vaccine development will be, can we develop a vaccine that triggers that antibody response, the right antibody response, and a robust antibody response? In other words, enough antibody. And then the other issue is, how sustained and long-lasting will that response be? People might wonder, why don't we have an antibody to the common cold? A couple of reasons for that. One is that a natural infection will only confer immunity for 3 to 6 months in the typical common cold type of coronavirus. And that's why you can keep getting common cold. And a similar issue then arises with the idea of a vaccine for common cold, and that is that those antibodies generated by the vaccine also don't seem to last for a long time. If we encounter that with this other coronavirus, with the novel coronavirus, both in terms of a natural infection, how long the immunity lasts from that, and in terms of how long those antibodies last from a vaccine, then we will get into the same issue where this notion of immunity passports and this notion of, you're safe once you've had it, that just won't be true. And that it might only last a period of time, maybe 3 to 6 months after infection. We hope that's not the case, but we have to be prepared for that possibility.
These are the kinds of things as more than 100 different groups work toward a vaccine. But we don't have one now, which is why we keep hearing from people like you, Dr. Gupta, how important it is, the physical distancing rules, the masks, the hand washing and hygiene protocol. I'm going to bring in some pictures, and I know we've sent you already the photos attached to these. Toronto is reopening into phase 2. Bars and restaurants get to reopen, and some bars, Dr. Gupta, they were right there at 12:01 opening the doors. And although they were really careful letting people in, you see what happened immediately thereafter. People congregating in large groups, not a mask there, definitely no physical distancing. I'm going to be talking to Toronto's medical officer of health. I wonder if you have a question for her when you see these and what concerns these pictures raise for you.
They certainly raise an alarm for me. I get it. It's been tough. We've all been cooped up in our homes. And then there's this balance between protecting people's lives and their health, but also protecting people's livelihoods and protecting our economy and the entire system that we have. The challenge, though, is that there is still community transmission. There are parts of the province where there isn't, and I think that's where a really targeted approach to opening up makes sense. But we still have community transmission in Toronto. We're still seeing cases. Happily, we're seeing less and less cases. We're seeing less and less deaths. One of the issues is that the numbers we see today really are reflective of what was happening in the community 7 to 10 days ago. As you know, Heather, it takes an average of 5 to 7 days for people to develop symptoms, and then it'll take some time for them to decide to, let's say, okay, go get tested. They get tested, then it takes time for that to get reported in the daily numbers. So if you sort of say, well, right now the transmission is really low, so I feel free to go out there and do things and take a small risk, but then in a week from now the numbers go way up, you've actually exposed yourself to that risk, because we're only seeing the results from, let's say, 7 to 10 days ago. So there's always that risk. And we've seen this. We've seen the numbers go down and then come back up again. We've seen that happen a few times. We're just not there, to my mind, to be able to have those kinds of interactions. I still think we need that 2-meter distancing in these public spaces.